Welcome to Beating Cancer Daily. Beating stage 4 cancer for 30 years still takes my breath away every time I say it. I'm Saranne, founder of the Comedy Cures Foundation, and I hope you'll join me for just a few minutes daily for the next 365 days so we may laugh, learn, maybe cry a little as we live our best days beating cancer daily together. Have you heard a lot of people talking about functional medicine all of a sudden? Everywhere I go, people are asking me for recommendations for functional medicine doctors. Now, of course, I was attracted to the topic because of the word fun-tional medicine doctors. That's right. F-U-N is in that word. So I thought, are those functional medicine doctors? Because they have more fun. They have a great sense of humor. They are just joy-filled. Well, hopefully that's the case. But I thought, wow, could you imagine if you got a functional doctor and you walked in and they just hit you with a joke or like a minute of stand-up when you came into their office for your appointment? So I saw a good joke that I want to share with a functional medicine doctor because I want them to put F-U-N-tional doctor on their business card. And I want them to tell this joke. So wouldn't it be funny if you walked into this doctor's office and this cartoon was sitting on the wall? It said cardiac arrest. And then there was a picture of a cop arresting a heart, and the heart ventricles were in handcuffs. And then the subheader read, and I would have gotten away with it too if it weren't for that meddling defibrillator. I think every functional medicine doctor has to have cartoons on the wall, and they need to open with a minute of comedy before they get to talk to you. Anyway, I wanted to learn more about functional medicine, and we have two people who are completely obsessed with functional medicine in the Comedy Cures Foundation. You read them every month in our newsletter. And Jackie Bryan is one. She does our Health Builder series. She's fabulous. If you haven't already attended a monthly Health Builder workshop for free, go to the Comedy Cures Foundation website, front page, and sign up. She's incredible. And then the other person who is obsessed with mind body, and we just love her so much, is Kathy Pudiak. And I often discuss a lot of concepts with Jackie and Kathy. And so today I had a really good conversation with Kathy Pudiak, and I wanted to share some of the things that we discussed. So functional medicine, just so we all get on the same page about it, is a new approach to treating disease. It's like medicine 2.0. Many conventionally trained medical doctors have already welcomed this new approach, and they've taken courses to become certified as functional medicine practitioners. So they learn about a new way to take a patient's medical history and about specialized testing. And many physicians don't agree with functional medicine theories, and they shy away from it. But these new approaches are fascinating, and I want to make sure that you know about them. Especially if you're going through cancer treatment, this could help you get through some of the side effects and also maybe never to have a reoccurrence again, because functional medicine doctors have a very unique approach to handling disease. They don't just describe medicine to control symptoms. They want to really dig deeper to find the root causes. Now, I'm not slamming traditional medicine doctors. I'm just showing you this new approach that functional medicine doctors take. The analogy that Kathy explained to me, which I want to convey to you, is that it's like a tree whose leaves are turning brown. Rather than just cutting the leaves off or spraying some chemicals on them, a functional medicine doctor will attempt to go down to the roots to find the cause of the problem. They are like detectives. They're looking for the underlying factors, such as imbalances in the body, the effects of the environment on the patient's health, their genetics, and even possible emotional influences on the disease process. Now, we've talked a lot about the mind-body connection and how important it is to control your stress, try to reduce it, to have strategies for remaining calmer, for processing unexpected trauma, residual trauma, and many things that can really hamper the immune system because you are dealing with them subconsciously. So don't you want to know, if you've never been to a functional medicine doctor, how your patient experience will differ? Well, the whole intake process is very different. It's a lot longer than traditional medicine. So a functional medicine doctor will ask you not only about your symptoms, other medical problems you have, your past surgeries, your allergies, your habits, your family history. But what's really interesting is that they do it in relationship to your timeline. They ask you questions delving into what was going on at the time you were in utero. What was the situation in the house that your mother was living in at the time she was pregnant with you? What was her diet? What was her emotional state? What were the environmental toxins she may have been exposed to? Now, I will tell you, my mom was not interested in being pregnant. She was a model. She was 19. She didn't want to show. She smoked and she drank. Now, what worse situation could a baby be in? This is all relevant to a functional medicine doctor. Is it any surprise that I had aggressive cancer? And I'm not blaming my mom. People smoked and they drank back in the day. In the decades when I was born, that was easy. People just did it. They didn't know what they know today. But I have vivid stories of her telling me that she didn't want to gain any weight because she had to model. So she used to squeeze me into mini skirts and tight dresses and tight jeans, and did not eat because she didn't want to put on any pregnancy weight. Now, surprise that I was born at 2 pounds, 10 ounces, 28 weeks. That was 12 weeks earlier than what is considered standard. Now, I've told this story before, but not in relationship to functional medicine. So these are the kinds of things that will really help your functional medicine doctor if you can come prepared with some of these answers. But you're going to get time to go through all this. Now, they will ask you all about your childhood, all the way up to adulthood. And they're going to be matching symptoms and disease to these times in your life and what was going on with you environmentally, emotionally, and mentally all throughout your life. Often it will be discovered that symptoms popped up at times when there was major stress or major life changes, and when you changed your residence. Why? Because you could have been exposed to new allergens. It is real detective work, and it's fascinating. Kathy was telling me that as a physician's assistant, she can really appreciate how much more can be discovered about a patient and the possible causes of their disease when taking a history in this unique way. Now, if you don't know what physician's assistant is, they are trained like a doctor, but they work in collaboration with an MD. They can do almost everything an MD can do. So I bet you're curious if you have to do a lot more medical testing. And yes, there's unique testing done by a functional medicine doctor. They do many kinds of blood tests, urine tests, stool tests, and they really look to assess the patient's nutritional state, immune function, the presence of inflammation, infection, allergies, something called toxic load. It's how much toxicity is in your body. We all have it, right? We don't live in an environmentally clean place. We don't all eat environmentally clean food. There could be more alcohol in our system. They really look at the gut biome, and that's the bacteria that's in your system. They also look at neurotransmitters and hormone levels. Isn't this cool? Don't you all want to run out and go to a functional medicine doctor right now? But wait until I infuse the comedy, because that'll be more fun. Now, functional medicine doctors also often use repurposed drugs, herbs, supplements, and they really help the patient make substantial lifestyle changes to improve the quality of their life and also for wellness. I didn't always know what a repurposed drug was, so I'm going to explain it. Repurposed drugs are actually kind of really fun and fascinating. These are drugs that the FDA approved for one disease, but it's been discovered that they're useful in treating other diseases. A good example is thalidomide. It was originally developed for the treatment of anxiety and morning sickness, but was later found to have anti-cancer properties. And now it's widely used in treating multiple myeloma. I told you it was cool. I bet you're wondering, Saranne, how do I find a functional medicine doctor? Well, that's easy. There's a website for the Institutional Functional Medicine, and I'll give you the website. It's ifm.org. I'm going to repeat that. The Institute of Functional Medicine is ifm.org. And if you just click on that, there's a green box on the right that says Find a Practitioner. And if you go there, the website actually explains a lot more about functional medicine in great detail in case you want to learn more. As you know, Beating Cancer Daily is a bite-sized podcast. So what I like to do is just share story starters. Just get you thinking about different ways to improve the quality of your life, fight back your cancer, and hopefully have a long survivorship. And I just think functional medicine really needs to be part of the equation. So I hope you explore it more. I'd love to know what you think about functional medicine. So go to the comedycures.org website and hit the record button, or go to the menu and hit the contact button and write to me. Let me know what you're thinking. And if you have a good functional medicine joke, you can send it to me. I would love that. Have a blessed day, and I'll see you tomorrow. If you loved today's episode, then tell the world. Why? Because Beating Cancer Daily and our membership circle are both a listener and donor supported experience. So the more people you tell and the more people that join us, the more robust and interesting programs our nonprofit, the Comedy Cures Foundation, can bring to you throughout the year. I really want you to go to comedycures.org. And of course, I always want you to make a donation. It's tax deductible to the extent allowed by law. But what's super exciting is not only can you laugh and explore the comedy there, you can look at our membership levels and find the one that's great for you. And if you're feeling a little bit generous, gift one to a chemo brother or sister or to a caregiver that you just want to help them improve the quality of their day. Thanks so much. See you tomorrow. Guess what time it is? It's time for me to read the disclaimer. Beating Cancer Daily and the Membership Circle are not in lieu of medical advice or treatment. They are for entertainment purposes only. Please consult your healthcare team to review your best strategy. Thanks for listening.